Garmila Mohagat Cahirlock, and I'd really like to welcome Minister of State Mary Butler here. Department of Health with responsibility for mental health and older people to the Shannon. Minister, families are applying to the HSE Home Care Hours scheme. They're receiving approval, which is great, from the HSE Home Care Hours. However, no help or home care is coming. And there are delays, I know, and backlogs, and there's impacts with shortage of staffing. Minister, I'm requesting a Department of Health update on waiting times for people approved for family home care hours by the HSE for the Community Healthcare West areas of Galway, Roscommon and Mayo. Older people and those with disabilities in rural areas are urgently waiting for help. The Home Support Scheme, as we know, Minister, is for people over 65 or anybody with a disability or early onset dementia, which you've done so much work in. Usually it's for after a hip operation, any stay in a hospital, it's where it helps you settle back into home. But the challenge is that we have very few maybe step-down facilities. And it's in rural areas, in wide geographic areas, particularly in Roscommon and in East Galway, you're looking at a wide geographic area, so more mileage costs. This is what's happening for healthcare assistants. We're seeing younger members of the family moving away from home, making it more difficult, 20% increase in the over 65s in the last census, and our area of Roscommon and East Galway is particularly affected with an older age cohort. Frailty is a serious issue, Minister, as well as you'd fully be aware. Loss of confidence for older people. After that first fall, suddenly they've lost the confidence to go around walking themselves with walking aids or mobility aids. Our older loved ones are unable to handle a bath, a shower, dressing or shaving and need home help. Under the programme for Government, Minister, Our Shared Future, we have commitments for older people to live in their home with dignity and independence. Staff within the Community Healthcare West CHO2 are dealing with huge backlogs, doing their best to meet demand. I'm aware of the challenges in getting recruitment into the HSE. Again, the same challenges. And we need to increase e-health assistive technologies. Again, our social services in Ballinasloe are going to be opening up, but slowly. And this has had a huge impact still on home care services. The HSE have options to engage third-party providers of home care, approved consumer home direct support, CDHS. I suppose, Minister, how well is this working? Do private providers have the staff to take these referrals from the HSE? In other words, I suppose we need to be looking at the training. And again, as I know you've brought this up yourself, the levels of minimum wage and what the comparison is between the HSE and private sector. Minister, I'm aware of the 4 sites for the new home support pilot, which you've brought out. I know that you're looking at planning an additional 230,000 hours in our own CHO2 of Galway, Roscommon and Mayo. It's looking at Tuam, Athenry and Loughrea. Minister, in last year's budget, 5 million additional home care hours for 2021 were provided for this year in the budget last year. That was following on from the 19 million hours again provided in 2020 to alleviate community waiting lists for home care and support hospital avoidance. Minister, my questions for the Department of Health are the following. When will more pilots come on stream, particularly for the Ballinasloe area and the rest of the CHO2 area? The area around Ballinasloe, you're looking at a catchment of nearly 14,000 in the rural zone as well as the urban area. What are the figures? What are the waiting lists? How many third-party providers in the HSE are being used at the moment to support the rollout of this programme? What is the status of the new Home Support Office? I know that's only very recently looking at opening it up in August. And we again have 130 posts under the Inter-RAI Ireland system. Again, what are the numbers on those? And the timeline, perhaps, Minister, if you can give this for your new statutory home care scheme. Minister, I know your commitment to the home care support area, and you're a previous spokesperson as well on health, where you would have known this area extremely well. We need access to resources in rural areas, wide geographical areas, and there are challenges there because there's a wider area to cover. For healthcare assistants, we're talking about mileage costs. We're talking about increased costs for private providers. Older people are living alone in isolated areas, and when HSE home care hours are approved, they are urgently required. Urgently required. We need to make sure that we are supporting people to live with dignity and independence in their own home. Gurmil Mahagat.
Gomagad Shandor Aisling Anish Aristot Keranomid.
Garv Mahagut Cahirlock. Thank you, Senator Dolan, for raising this really important issue. It is a key priority for government and for myself to enable more people to engage in services that allow them to remain independent and live in their own homes with dignity and independence for as long as possible. To advance this, the government is committed to establishing a new statutory scheme on the financing and regulation of home support. So, as you quite rightly said, in July I announced the selection of 4 sites to test a reform model of service delivery through the delivery of 230,000 hours of home support. So this pilot will underpin the development of the statutory scheme for home support services and will be fully operational by the 1st of November. And as you quite rightly said, in CHO2, Tuam, Athenry and Loughrea were the areas that were selected for the pilot. A National Home Support Office will also be established before the end of this year to support the testing of the reformed model of service delivery. In addition, the approximate 130 posts have been funded for the national rollout of the Inter-Ireland system, which the Home Support Pilot will test as the standard assessment tool for care needs. Recruitment of these posts is just underway and for Q4 of this year. In parallel, work is ongoing in the Department to make progress with other aspects of the scheme, including the development of a regulatory framework and the examination of options of the financing model, and the RSI are doing some work on that for us. While the new home support scheme is under development, the Government is prioritising improved access to home support services for older people. The largest budget ever investment was made for home support for older people in Budget 2021. And Cathaoirleach, my budget this year for home care supports is 666 million, a phenomenal amount of money, with the allocation of an additional 150 million this year. The National Service Plan sets a target of to provide 24 million hours of home support. This is ambitious, to increase provision by 5 million hours in 1 year, or more than 25% above the target. The COVID-19 pandemic has led to unprecedented challenges across our health services, and none more so than in older person services. While there has been challenges in the delivery of home support hours, particularly during the third wave of the pandemic, significant progress has also been made. Provisional information, which may be subject to change, indicates that at the end of August 2021, over 13.2 million home support hours had been provided to 53,900 people. This is about 2 million more hours compared to the same period last year. Approximately 478 people were waiting for funding approval, representing an 88% reduction compared to the same period in 2020. And as a result, the preliminary figures indicate to me that these extra hours have resulted in 1,200 people, 1,200 persons not having to enter nursing home care this year. So that's a great achievement. The consumer-directed home support approach facilitates funded clients to deal directly with the HSE-approved providers of their choice and to arrange days and times of service delivery. This is available in all CHOs across the country. However, based on a recent evaluation undertaken by the Office of the Assistant National Director for Older People, it found that the uptake of this approach nationally has been minimum since it launched in 2018. So to answer your questions, provisional data from HSE indicates that there was only one person waiting for funding approval in CHO2 at the end of August. However, 651 people are waiting on carers, so 212 in Galway, 325 in Mayo and 114 in Roscommon. So the challenges we have are not financial, the challenges we have are securing the staff. So I'm in a situation where there are only 1,400 people waiting for funding, and by the end of this next month there'll only be 500, but the challenge is to recruit the staff, and I'll touch on that in the next sector.
Thank you very much, Minister. Now, Senator Dolan, you have 1 minute, please.
Look, I want to thank the Minister for her response, but I am shocked at that, Minister. I mean, it is, and I understand finance has been provided, the budget has been provided, the government and the programme for government has indicated the support for home care hours, but we still have these challenges that we have to rectify. No one else is going to rectify the recruitment processes within the HSE or within the CHOs. We have to do this. We have to look at the numbers of the third-party providers, CDHS. How many of those are being used to support the CHOs in delivering this? I mean, the staff within the CHOs themselves are struggling and crying out for help, trying to deal with this. 651, 212 in Galway, 325 in Mayo and 114 in Roscommon. These are all families that are struggling and again that are urgently looking for help. Our hospitals aren't able to keep them in hospital. We saw the waiting list, we saw the issues in UHG yesterday. In Portiuncula, the number of people in our hospital, and probably the same in Roscommon town, is over 60s, and there's nowhere for them to go. And again, some of these families are living longer, which is great. Life expectancy is increasing, which is wonderful. However, we're still not able to support them living in their own homes, all part of Sláintecare. These people have suffered over the last 18 months, Minister. I know that you are doing your best, but we have to do more. I would be interested in comparing this to other CHOs. Is this the same for other CHOs? For other geographic areas, is this the same? I would be very interested to find out. So thank you very much, Minister.
Okay, thank you, Senator Dolan. Final minute.
Thank you, Senator. Yeah, and if I could just reiterate, there is only one person waiting for funding approval in CHO2, and that's what makes it so frustrating, because previously the challenges we had were the amount of people waiting for funding. So of March of last year, there was 7,250 people waiting for funding in the country. There's now only 1,400, so we've made huge strides. But efforts are ongoing to meet the demands for home support services. The HSE continues to advertise on an ongoing basis for healthcare assistance and recruits as many suitable candidates where possible. The HSE conducts its recruitment through a variety of channels. I would also like to say the split between public and private provision is a 50-50 split, but it varies in whatever CHO you're in. On Tuesday of this week, I met HCCI, who provide advocacy for all the various groups, the likes of Home Instead, Senior Care, Bluebird, that provide. I'm actually speaking at their conference at 12:30 today. They have huge challenges around recruitment. The HSE have huge challenges around recruitment. And just to say, if the Cathaoirleach will just allow me say this, because the notes were a bit long, we have agreed to set up, wait, can I just find it here? We have agreed to set up a task force to look exactly at the challenges. You asked me a question, is it the same everywhere? No, it's not. It's not the same everywhere, but rural areas are proving very difficult, and there are a lot of challenges in relation to private providers who don't support mileage, and that's an issue as well.